Okay, hello everyone. Welcome to today's session, DE&I Best Practices with Parexel. Big thank you to everyone on the panel who has joined us today. We'll do introductions shortly, but as you can see, there is a chat function on Teams here. So if you do have a question you'd like to ask the panel, please do pop it in the chat and I'll make sure it gets asked later in the Q&A section of today's webinar. This is also recorded, as you can see. If you'd like a copy of the recording, just send us an email, sales@PharmiWeb.com, and I will make sure you get a copy of this recording today. Regarding questions, if you'd rather ask a question anonymously, you can also email us, sales@PharmiWeb.com. But other than that, just pop them in the chat and we'll make sure they get asked. In that case, Vince, I'll hand over to you to do introductions.
Lovely, thanks, Simon. So welcome everybody to today's session. This is a new format for us on our webinars where we will be inviting guests in to talk professionally about what they're actually doing in the industry. And I'm delighted to get the whole team pretty much from Parexel to come and talk to us today, which is fantastic. So just so that you know, I've been running these webinars now for the last 3 years globally. And because of this new format, we're just trying it out, and I'd be very interested in anyone who's got any views about it afterwards. Simon will MC the meeting and ask any of the questions that come through the chat as usual, and we'll move straight on from there. So first of all, I'd like to introduce Jeff Bath, who's going to talk to us a little bit about what he actually does for the organisation, so you can meet all of the panel, and then we'll go straight into questions. Jeff, over to you.
All right. I guess I'm first. Thank you. It's a pleasure to be here with all of you. Thank you for allowing us to come and introduce ourselves and talk a little bit about the DEI journey at Parexel. I will just preface my introduction to indicate that we certainly also see ourselves learners here and collaborators with you all. So looking forward to hearing from you all of any ideas and how we can collaborate with you. I've been with Parexel for about 4 years. I have a bit of an interesting background there because before I came to work here, I was at an organization by the name of Catalyst, and Parexel was a client of mine. So that was how I got connected into the organization. I work fundamentally on the HR, specifically within DEI. Catalyst is a nonprofit that supports gender inclusion in the workplace, and Parexel at the time was piloting some programming with us, which I will talk a little bit more about later on. That was based on some new research that was aiming to figure out how to measure success around metrics within DEI, which I think is a really interesting topic, given I'm sure what you see in the news on how DEI is working and whether it is working and such. I really enjoy my work. I get to work on a lot of different aspects, including analytics and metrics and a lot of our strategy. I'm also the co-lead of our Pride team and advisor with our other steering committees, which include disability and race and ethnicity and our gender team and such. Personally, I live in New York, so and I'm from Utah originally, if any of you are familiar with that. I love the Northeast. My family and I live just outside of New York City. I spent about a decade plus in New York, and we've settled down in the suburbs. And I have twin girls who are 4.5. And so if you have any questions about that, I'm happy to share some things that keep me up at night. And then I am married to a doctor. So while I don't work in medicine, I like MDs. My husband and I are really happy to be where we're at. And again, this is just a great opportunity. Thank you for having me.
Lovely. Thanks, Jeff. And I'll just quickly move on so that we can actually get going. So Kevin, a little bit about you.
Yeah, hi everyone. My name is Kevin Nicholson, Senior Director of Talent Acquisition for Europe, Middle East and Africa. Been with Parexel now for 15 years, almost to the day, to be honest. I joined from what used to be known as PRA International. Prior to that, I was at INC Research, for those of you who've got a long memory, and I was at Covance before that. Got a strong interest in DE&I, and I've been involved, heavily involved actually in DE&I activities within talent acquisition, going back to probably about 2017. I live actually not too far from Vince. Actually, I live just in a sleepy little town called Yateley in northeast Hampshire. Got 3 kids, and I'm about to become a grandfather later on this year. So that's me. That's me in summary. All right.
Lovely.
So I'll hand it on to the next person.
Thanks, Kevin. Okay, I'm going to move over now to David. David, if you can come back on screen, that'd be great.
Yeah.
Perfect. Tell us all about you.
Thank you very much. Yes. So David Dent. So my day job is I'm an executive director. I lead business development and market and business development for Europe for Parexel. I also have the pleasure of co-leading the disability strategy steering group, which we set up just under 2 years ago, and we call it Parability. In terms of my kind of personal background, I suppose importantly, I should say that I have an acquired disability. So I got injured and I use a wheelchair now. And 7 years with Parexel in the kind of commercial function, working with a lot of pharmaceutical companies, biotech companies, startups. Before that, I was in the Army Medical Services in the UK as a trauma specialist and intensive care, which is how I acquired my injury. I also teach at 2 universities, Nottingham, Stirling, mainly in business and entrepreneurship. And I'm part of a couple of leadership organizations, being a companion, chartered companion at the Chartered Management Institute and a fellow at the Institute of Directors. And I think being somebody who has dual nationality, and maybe if those can't see me, I am, you know, a white man in his 50s with blonde hair, but I'm actually Jamaican, as well as being British. So I kind of first experienced sort of what it's like to be different in the hiring process when I didn't get a job because somebody didn't want to give me a job because they saw Jamaica on my application. And I have obviously leading the disability group, but also I've been kindly invited to be an ally on race and ethnicity, on LGBTQ+. I also mentor some of our aspiring female talent in the organization, as well as some of the interventions that I'm sure Jeff will talk about before. So very passionate about this subject. I feel it should be part of our core DNA, not something that's additional. And I'm sure going to talk about the value that diversity brings to organizations and businesses like the one that I lead in Europe and my colleagues lead elsewhere. So thank you.
Lovely. Thanks, David. That's fantastic. Okay, moving on to Amy. That's a little bit about you.
Okay, great. Well, thank you, everyone. We're so excited to be here. We really appreciate the opportunity to talk with you. And, you know, Jeff started off by saying that we do want to learn from you as well. So it is important to put those questions in the chat because we do want to know what's on your mind as well, so that this can be more of a dialogue once we get through these introductions. So I'm a senior director on the Global Talent Acquisition Leader team. I've been with Parexel almost 11 years. It'll be 11 years in August. So my background before Parexel was in different industry. So I focused mostly on emerging talent, working with universities, launching careers. I work with internal development programs, taking people who are ready for the next step in their career at Parexel. So my background prior to coming here was on Wall Street, as a financial analyst initially, and then moving into recruiting there. I also spent 11 years at PricewaterhouseCoopers, leading college recruiting in the US. And I spent time with a global engineering firm. So my specialty by day is universities and students and interns and just like launching the careers. Really, that is super exciting for me. And then working with our internal candidates who are ready to like progress in their careers. But on top of all that, I lead the Global Talent Acquisition DE&I committee. So we have members from all different regions. We have about 20 We come together on a monthly basis, and we basically take the corporate DEI goals that come from Jeff, and we make them apply to the talent acquisition world. And we have a lot of things that we work on that are kind of flexible by region, right? So it's been incredibly rewarding. I think we were one of the first committees that launched in 2017. So Jeff's nodding that I am totally ahead of the game there. And we have a lot of things we'll share with you as we go through this. I live in Newport, Rhode Island. I'm originally from New York. I am a New Yorker like Jeff. Lived in the city for many years, spent most of my career in New York City, but moved up to the Northeast as an empty nester. I also have twins, except mine are much older than Jeff's. Mine are 22. They're identical twin boys, and they live in New Hampshire. So I was a single mom for 16 years, juggling my career, building my career, and raising my boys. And now they've flown the nest. So I'm the crazy cat lady who's just here with the cat now. But that's a little bit about me. And I guess we're on to Rebecca next.
Lovely. Okay. So Rebecca, a little bit about yourself before we carry on.
Oh, thanks so much. Yes, so hi everybody, my name is Rebecca Hastings. I'm VP of within our project management organisation, so I'm firmly embedded within the business. But what brings me here today is really a strong allyship for all things DEI. I've been involved in the UK and Ireland DEI committee, I think for 3, possibly 4 years now, and then was really happy to take over the lead at the start of this year. Similar to Amy, I've also had time as a single mom, and know the pressures that can put on women, the importance of flexibility. But really, as you know, my role within project leadership, I think it's, you know, all teams, the diversity of the input that we bring leads to better teams and better solutions. So I'm really focused on areas such as women in STEM. I've been involved in our Women in Leadership program. I'm also a mentor for STEM, for our Wisdom program. A strong interest in neurodiversity. I have 2 dyslexic children and a whole host of family neurodiverse inputs. So a strong advocate for neurodiversity being positive in the workplace. And then also an ally for all things LGBTQ as well. So very happy to be here. I'm based just outside of London, southwest London. Look forward to speaking to you today.
Lovely. Thanks, Rebecca. Okay, so we're going to be asking some questions just to get things going in a moment. But just before we do that, I just wanted to say that one of the reasons I asked the team at Parexel to come and join us today is that we'd heard a lot about them in the marketplace, about what they're doing. As a global CRO, you know, they've got a wealth of experience in this area, and it's really, really important, as we all know. But from my point of view, I was interested in how it works strategically at a global level down to a local level as well, which is really interesting, and had some really good feedback on that. So things like standards, global policies, creating your own best practice is really difficult sometimes because you've got to start from somewhere. And I think, as Jeff was alluding to when I was talking to him earlier, you know, this is an evolving practice. You know, you're getting it right, you think you're getting it right, and then things change and you've got to move on. So you've got to be agile and you've got to be able to predict what's coming in the future. So I'm delighted that they're here today to sort of share that knowledge and experiences with us. And I think, as Rebecca said, if you've got any questions, start to get them out there now so we can ask them. And one of the key things that most people say to me when we talk about DE&I is, you know, what's the true benefit and value to the company? You know, it's a lot of time and effort sometimes to make it worthwhile. So bear those things in mind. So I'm going to kick off with asking Jeff a question, actually, because I've got some here that I just wanted to run through. So first of all, Jeff, if I can put it to you, you know, companies are positioning this work under an evolving terminology, you know, diversity, equity, inclusion, belonging. Why is that? And what is meant to be captured strategically by those terms? What does it mean for you?
Yeah, thank you for the question. You know, I would say very simply, what this is trying to do, it is trying to create a system or a culture that allows individuals to thrive. right? So that is our goal. That is what we're doing. How do we create space for people to bring their full selves so that they can commit, that they feel that they are a part of the narrative, that they're a part of the story. And, you know, I would say I am old enough to remember when this work was really just diversity, right? That was how it used to be framed. And I think you can derive some insight into the progression of how we talk about this, because when originally when we were talking about diversity, a lot of the implication here is that you are literally just counting the number of seats and the number and the individuals that sit in them. And people used to say butts in seats, right, for lack of better etiquette. But that was what was seen was important. And businesses have evolved. We have learned a lot. We have moved forward in how we work and how we understand each other and how we collaborate. And just because your workforce is diverse does not necessarily mean that your groups are functioning cohesively, of course, or that that individuals are advancing, that they are being promoted, that they have access to what it is that they need to be successful in hot jobs, or even are assigned like those hot positions, right? So, and importantly, just because you measure it does not mean whether or not your employees intend to quit, right? Whether they like who you are as a culture. And so we have come to better first understand the difficulty of talking just about diversity, right? That it is more than just about what you see. It's about what is invisible, whether it's something like a hidden disability, or whether it's gender identity or sexual orientation or education or interest. It is much more complex than that, right? And so in allowing space for individuals to thrive, it means that we create the system where individuals, they feel included in what we're talking about. And importantly, that we're designing a culture that gives resources equitably. So it's not, again, about just having all those chairs, but understanding that groups have unique needs and individuals, in fact, have unique needs. And that is a very different place. It is much more deliberate than where we were 20 years ago. You know, and so for us at Parexel, we call this our vision, where all feel valued, all feel respected and supported. And from that lens, we believe that's something that all can get behind. And in fact, when it comes to talent recruiting, that is very appealing to the marketplace, for individuals to understand that they are coming into a place where they are respected.
That's very good. Yeah, I mean, you guys do very well when actually bringing people on board. That's for sure. So, what does progress at Parexel look like in DE&I, and what do you think the fundamental pieces are that led to tangible change? Because, you know, a lot of things have happened just recently, more than anything else. And I know you guys have been doing this for a long time, but I know a lot of people have gone through changes. What's your view on that?
Yeah, I can start with that. Again, I know my colleagues have much to say on this as well. You know, I think, look, again, I just want to iterate that we still have a lot to learn, right? And we have had some moments of surprise where we should not have been surprised, right? And first and foremost, it's, you know, every organization wants to look ahead of the curve, and this is a topic that is really important, to look ahead of the curve, right? We've even had some of those very recently, and not fully understanding the needs of diverse groups, right? But I would share two main pieces of learning that I think have really helped us stay on course. You know, fairly similar to most organizations out there, the work for Parexel started as an initiative to support gender, and then it just kind of morphs into this body that touches much more aspects of diversity like it needs to, right? So we started in 2014, and at that time, and it's something that we've continued today. When we talk about gender, we have intentionally set this up as cross-gender partnership. That is really key. And at the time, that meant full participation between men and women. Whereas now, speaking of that evolution, right, we understand that we're talking about more not just in binary terms, right? But the aim here is still the same, that all have a stake in this conversation, and specifically on this topic, men as well, right? And so if I were to give guidance to others that are just starting out on this, it's this message of the framing has to be about how we all lift each other up, and that inclusion is about everyone, right? Otherwise, you're left with this misunderstanding that that of who has ownership, or importantly, who is responsible for speaking up, who is responsible for resolving challenges and identifying solutions. And for us in particular, I can't think of anything more effective to that end than some of our earlier work, where we brought in senior leaders, both men and women at the time, and we would spend days together just unpacking and exploring what it means to have a mantle of full partnership. And that was groundbreaking for us. And it shows up in our metrics, where we have a goal of 40% both women and men at all levels. And again, we also now measure non-binary, but in truth, that number is less than 40%. But I'm not aware of any other company that has been deliberate or as vocal about how we count all. And that's also true with race and ethnicity, where we're looking at people of color, and in the US, people who identify as white, and that's also true in the UK. And then we also now measure our LGBT population and those that identify as disabled, whether publicly or not. But we're counting those who identify as heterosexual as well. And the second piece that I'll just say here, and then I'll pause, is that we have worked really hard to connect the rationale of inclusion across all areas of our business. Right. And unless a business can really get it to their bottom line, you're just not going to get the progress that you need at the pace in which you need. Right. So we ended up with this place years later, where our inclusion strategy started out very narrow, and now it's about our internal staff, period. It's about our patients, period. And it's about our suppliers and vendors. And we have positioned this as this structure reports directly to our team that handles our ESG, right? And that includes, for us, that includes 2 members of our ELT and our chief of strategy. So we have found ways to really bring that inclusion conversation as a cross collaboration, where all are counted, and that it is connected directly into our business.
Wow, that's impressive. Okay. Let's move on to Kevin, if I may, just to get you all involved in the conversation. Kevin, critical question we frequently hear from managers in particular is how to attract and hire diverse talent, and what are some of the effective strategies that you follow to ensure a robust talent pool?
Yeah, thank you, Vince. We've done a lot of work on this. And I think some of the most successful relationships and partnerships that we've developed over the last few years, we work very closely with a social media platform called blackpharma.org. We've got a very strong partnership with that group, where we're attending events. We know the leadership of that particular group. They know us. We work very closely with them. We advertise our jobs with them. And we can help and advise, and they can help and advise us when it comes to how we position ourselves within the market. We've also done a lot of work with, again, another social media platform called MyGwork, which is for the LGBTQ+ community. Again, we partnered them. We partnered with them on events. We get our jobs advertised out there. But I think one of the most interesting things we did recently was, I think about 18 months ago, we did an interview organized by MyGwork for Attitude magazine, which is it's the largest LGBTQ distribution in Europe. So they interviewed our senior leadership, and it got a hugely positive response. It was a very proud moment, I think, really, because it took us outside of the clinical community. Some other examples. We fully believe that DE&I has got to be bought into and believed by our senior leadership. So run by Catalyst, who is Jeff's previous company, we run a course called Men Advocating Real Change. This is where we get our senior leadership, people who want to give the message back, right? It's all about promoting gender equality, okay? All about getting our leadership to understand the issues of gender equality, the problems it can cause, the hidden things that perhaps they don't see. And I will relate this story. It's quite interesting. Well, I think it's interesting. I was coming back from the Mark course. It was over in Berlin, and I was on a flight, and we were getting off the flight, and there was a lady just getting her luggage from the overhead locker, and she was just putting her case down. But a guy almost barged into her and said, "I'll do that for you," thinking he was being chivalrous. But I've got to say, the lady just looked embarrassed, to be honest with you. And it just occurred to me that, you know, there's a guy thinking he's doing the right thing, but is he, or was he? Was he just making a lady feel embarrassed? And that's a small example of how the Med Advocating Real Change course starts to change your perspective on things. And it's a very, very interesting conversation, or very interesting course. Other things we do, though, we've got all new line managers have unconscious bias training. So we want to make sure that when we're interviewing staff, that, you know, any unconscious bias is dealt with, it's understood, and it doesn't happen. That is incredibly important for us. We've also done a lot of work on the differently able community, but I will let David speak about that. And yeah, it's you know, these are just some examples of what we've done, but we're very, very proactive and very passionate about diversity, equity, and inclusion at Parexel.
Yeah, very good.
Vince, back to you.
Thanks very much. Okay, well, let's move on to David. So David, a question for you. Why is it important to implement a disability inclusion strategy? And what advice would you have for other companies to help propel them forward?
Yeah, no, thank you, Vincent. And I just want to circle back a little bit to the question that you were asking, Jeff. I think one thing that I see, and I have lucky enough to work outside of my industry and in academia as well, you know, you get people coming up with their corporate strategy, you know, in terms of the environment, social, governance piece, the ESG that Jeff was talking about. You know, there's sometimes a requirement, you know, globally, we have the UN do this through, you know, their strategic development goals. And I think about 8 of those actually address disability, amongst other things. So we know that there's a great need in there in society in general, but also in business. But there was a recent report called the Everyone Economy, which highlighted what they call the intent to action gap. And there is a risk of what organizations get accused of is what they call virtue signaling. And this has been done in the environmental space a lot. And it speaks to an organization's brand reputation as well, which is obviously a key attracting element to people that want to come and work for a country. I think the company's reputation and the culture, as much as that can be visible, but people get stuck at, this is the right thing to do. How do I do it practically? And for me, this is why I love working with this team and other colleagues, is that practically we're making some differences, you know, deep down in the organization. It's not just a statement. Now, importantly, you do need leadership sponsorship, absolutely, and you need to have that direction from the top. So coming to disability specifically, you know, it's a little ironic, and I can kind of talk to this in every culture, I guess, around the world, but it's the largest group, but it's the one that's forgotten the most. So if you look at a lot of organizations, they will have a DEI focus, but disability won't be part of that. Now, if you take gender, we were talking about before, actually 1 in 4 women in their lifetime will have a disability. So if you're trying to address gender challenges in terms of female leadership, and you don't even take into account disability in any shape or form, let alone the complexities of what's called intersectionality, where if you're part of more than one minority group, you have an added burden of challenge. I think these are all kind of contextual elements. But practically, we had that sponsorship. We had a real drive that we want to really look at how can we do better. As Jeff said, we know that we're not the best, and we know that we're building the bridge as we drive across it. So what can we do? We looked at culture, we looked at policies, we looked at practices. Now, I think when you look at the research that's out there around disability, there's two main reasons people don't hire people with disability. So unemployment with people with disability is twice that of able-bodied people. And that doesn't really matter which country. Some countries are worse, but nobody's particularly better than that. And the two reasons in confidential research that are shown is one is people make an assumption that people with disability will be off sick more. And the other assumption that they're going to make is it's going to cost me a lot of money to be able to do all the things that they need to have done for them, both of which have been proven to be incorrect. 70% of accommodations for people with disability don't cost anything at all. They're things that are built into laptop programs. The upside of that devastating COVID pandemic was people got comfortable with people working from home, and a lot of people with disability have an adapted home environment and are very fruitful and constructive doing that. We have a colleague who's paraplegic, and he does his full job from home in South Africa. Fantastic job. So we have to kind of educate, and this applies to a lot of the other groups as well. We have to educate unconscious bias away. We need allyship. We need to dispel some of these myths, but then we need to put practical things in place, personal evacuation plans, a way of how can I get a different headset so it helps my hearing. If I have ADHD, is there somewhere I can go for a quiet room just to, for a little bit of time? Can I not be sat under the flashing light? Can I not be next to the thoroughfare? These kind of practical considerations. But we do this by a community of knowledgeable volunteers who contribute their diverse views, and we try and take that into account, as well as these partnerships that Jeff spoke about. So specifically in hiring, looking at neurodiverse hiring, but again, getting an organization external to give us the best advice so we can make adaptations to our hiring process that best accommodate. And a lot of organizations don't even think or even ask the question, do you need anything to allow you to get into our building? The interview room, would breaks happen? So that how can we make this the best experience so you can do the best job in your interview or even in your work? And then how can we help? And most of these things are easily solvable. So I think it is that from the executive level right down to the practical, measurable things, because we know that in the pilot program that we looked around hiring in neurodiversity, we had something like 10 times the amount of applicants who were all suitable for and passed the assessment criteria, because we just tapped into a talent pool where they have not been made available because of this unconscious bias that sits within organizations. So I'll pause there. You can probably tell I'm really passionate about this because I've seen some great results, and happy to take questions later as well. Thank you.
Wow. That was amazing. Thanks, David. Okay, for the sake of time, I'm going to move on. So, Amy, I've got a question for you. You lead the DE&I Talent Acquisition Steering Committee, and I've done so for a number of years now. What advice do you have for others who are responsible for inclusion deliverables, and what are you most proud of that your team have achieved and accomplished? Oh, you're on mute, Amy.
Sorry, unmute. That's a great question, right? So we were one of the original steering committees back in 2017, and I'm most proud of the fact that I think 80% of the people who are still on our committee were part of our original committee. We have a great retention rate in talent acquisition. So we've had a great retention rate on the DEI Global Committee. And I'm most proud of that, is that we enjoy working with each other. We've made progress, and we still bounce things off of each other to make sure we're going in the right direction. But I think the retention alone of the people on my committee who are still dedicated to it is probably the greatest accomplishment. We look at all different types of, regional influences. We look at local input, and then we also work with Jeff to understand what's the corporate view, and we mesh that together. So whether it's an initiative to reach out to Black communities, like Kevin spoke about, in our partnership with Black Pharma, there's also our partnership with Black women in clinical research in the U.S., right? We spend time looking at what the corporate strategy might be, and then we take it to the level where we can make input and get results. So in partnering just with those two organizations, we've been able to advance the numbers of, new Black members of Parexel, right? So we're able to take something that's at a high level and then put action to it. David just spoke about the new partnership for the neurodiverse committee. So again, that starts at a high level, and then there's a cross committee that comes together, and then we in TA take it to action, right? We have an external organization that helped to qualify the talent. Internally, then recruiters on my team help to assimilate and get those individuals onboarded into Parexel, right? So we look at things very differently, but the retention of the people on our committee, that's the thing that I'm most proud about. So I think if you're starting out a committee, you need to really find the right people. We have 183 people in talent acquisition globally, and I can comfortably say that I would not want all 183 of them on our committee, right? You want the right people. So if you haven't done a new committee, especially as it relates to talent acquisition, you don't necessarily need just your best recruiter. You need someone who has vision and who is an advocate for DEI, all aspects of DEI. I think an ally to all aspects of DEI is really important, and that's not for all recruiters, right? Some just like to recruit and do their work. So if you're starting out, I would definitely look for people who are more connected to maybe your corporate DEI strategy, people who've had experience in it, people who have that passion. I think you want the retention because that only proves to be you're more valuable as a sum, right? That saying, you're better as a sum than individual parts, and that's the success of my committee, quite honestly. So those are just some of my initial thoughts.
Well, obviously passionate about what you guys are doing, so that's the main thing. For sake of time, because I know we're slightly overrunning, so Rebecca, a question for you. How does the company maintain a real and meaningful focus on engagement and DE&I in the UK and Ireland? Let's talk locally now about what you guys are doing here.
Yeah, thanks, Vince. I'm going to try and keep this super brief just so that we leave some time for questions. But hopefully one of the things, one of our kind of tags at Parexel is with heart. And I think you can probably see from the people who've been speaking here today that really that kind of with heart piece shines through in terms of our commitment to DEI. And I'm also really proud, the UK and Ireland have actually led the way in many of these areas and raised several areas up our kind of corporate agenda as well. Areas such as menopause, such as parability. And I think there's a few things, and I'll try and be brief, that are important in doing that. So firstly, in terms of senior management advocacy and sponsorship for some of these areas, both locally within the UK and Ireland. So I link with key leaders within the UK and Ireland, but also obviously globally, together partnering with Jeff in terms of linking into the ELT as well. We're structured in terms of work streams. So we have a committee, we meet regularly, we meet on a monthly basis. We have a lot we want to cover. There's a lot of passionate people in the group. We have a lot we want to cover. And so we kind of set a path of divide and conquer. We have a number of work streams: gender, neuro, diversity and disability, LGBTQ, region, ethnicity, probably one that I've forgotten. And we're structured. So we set out what we want to achieve over the year. We have clear objectives. We have a calendar for key events, key celebrations, and so we keep focused, really. Within the committee, we try to buddy up. So there's a number of people who are particularly, maybe they have a particular interest or particular impact in a particular work stream. But there's often allies who want to join a particular area. So we often partner up people, and that happens quite naturally and ergonomically. I think one of the other key areas is communication. So we try to make sure that we are visible, that we are present, and that we are also listening. So to echo some of the other points that people raise, we don't pretend to know it all. We don't pretend to get everything right either. And so making sure that we are listening, making sure that we provide avenues for feedback, and we're also always open to suggestions and areas that we haven't considered, blind spots, areas where maybe we got it wrong. Recently, for example, in the reach space, we'd been celebrating a lot of, in our mind, we were celebrating diversity. We were celebrating a lot of kind of alternate religious festivals, and had completely forgotten all the kind of Christian festivals. It's like, okay, yeah, hands up, we got that wrong. Now we've added that in. So now we are inclusive across a number of different areas. So yeah, face-to-face, we do a lot of remote communications, regular updates, at least once a quarter, kind of reminding people this is what we've been doing. These are the things that we're doing, send us your ideas. We try to link with other regions. That's really important, to share ideas, share input, and then also linking with external partners. So it's fascinating to do things like this. We want to keep fresh. We want to keep connected with things, other industries. How are they approaching this area, and bringing all of those ideas back into our own forums.
Well, the passion's certainly coming through, and I think the other thing that's coming through is your openness to, take on board anything else's views on things as well. So, yeah, excellent. Okay, so I'm going to go over to Simon. So, Simon, what questions have we got? And let's put some of these questions to the panel there, if anything's come in.
Yeah, I do. I've got about 6 so far. So if there are any other questions, please do pop them in the chat, and I'll add them to the list. Shall I just get started and work my way down what's coming?
Yeah, guys, put your hands up if you'd like to answer this, or I'll pick one of you at random. So far away, Simon.
Perfect. So the first one I've got here are, what are some common challenges or barriers that organizations encounter when trying to promote DE&I, and how can they overcome these challenges?
Okay, shall we push that one to you, Jeff?
Sure. Well, I think the biggest one is inadvertently framing this conversation that it is just about one segment of your staff. And I think, we had touched on this earlier, but you have to figure out a way to make sure that your inclusion is talking specifically about counting everyone. That is really critical in today's climate, both internally and externally. Look, and the fact of the matter is, even if you work for a for-profit company and you're not an activist organization, right? We all exit work and we live externally, right? Where all these conversations are happening, and a lot of it is the zero-sum conversation about who is being measured and who's not. And organizations, there's no need to weigh into this, right? Everyone counts, and that is the message, right? And that is true irrespective of your creed, your religion, disability, race, ethnicity. So really framing that and making sure the message is very simple over and over, and using that as your foundation. So, that capstone of your building is really, really important, and that makes people feel good. That allows us to exist in a space where we can respect and value each other, even if we don't understand, everything about the other individual, right? But knowing that we are all in this together is really paramount for business performance.
Right, thank you. I'm going to just pass that one on as well from a local point of view. I mean, to you, Rebecca, because obviously, same question really. I mean, what are the sort of barriers there? I mean, because you've talked about the collaboration with the senior management team and other regions. Was that communication probably the biggest part for you?
Yeah, I think you can never communicate too much, right? I think that's the point. So there's it's important to communicate to the body of employees. It's important to appeal to certain groups. It's important to get the advocacy of senior leaders so that they are supporting this narrative in whatever meetings, that they're encouraging their staff to participate, to be part of the conversation. I think, you know, one of the linchpins, and Jeff mentioned this earlier, one of the real key linchpins for the success is allyship. There's a number of people involved here who have a specific reason to be involved, but actually everybody needs to be involved in the DEI conversation, and we encourage everybody to be inclusive. It resonates with our kind of with heart narrative. So I think it helps to imbue that, you know, we care about our staff. We want people to bring their best selves to work.
Fantastic. Well, thanks for that. Simon, next question.
Yes, I've got a couple that are quite similar. So these are regarding capturing data. So I've got one here. How do you go about capturing data for DE&I reporting, especially when linking to disability and ethnicity?
Okay, so let's shall I pass that over to you, Amy, and see if that's a question that you can answer for us.
Yeah, I'm happy to jump in as well.
Oh, okay,
if you wish.
Yeah,
no,
I
I
was
don't
gonna
want to.
yeah, it's better for Jeff, and I'm going to pass that over to my colleagues, Jeff and David.
Okay, David, far away.
So maybe if I start with quite a narrow focus on around disability, and Jeff, maybe you can come in with a more broader perspective. But I think that particularly in Europe as well, there are external challenges from a legal perspective, you know, in terms of collecting data on different groups. So particularly around LGBT and disability, you know, disability is a very highly protected characteristic in GDPR. And so there are just some jurisdictions where you can't. So there are just some jurisdictions where you can't ask the question. But I think that we do, through global surveys, encourage the collecting of that data. There is a kind of self-reporting element. I think one of the things that it is recognized that if you don't measure it, you don't know where you are on your journey, and you don't know whether you're improving. So I think that the ethos of measuring it is right. There are operational challenges as to how do you do that. But you need to be able to kind of show that, and obviously once you kind of know where you are and your reference point, you get an idea as to where do you need to go. So I'd say disability is one of the more difficult ones to measure, but we need to find ways, and this is not a Parexel discussion. This is being discussed at governmental level in many organizations, you know, around data privacy as well. So Jeff, I hope that was.
Yeah. Thank you, David. You said a lot of the things that I was thinking as well. I would say on the topic of ethnicity, you in many parts of the world, because of employment laws, you already have the data. So and David is absolutely correct. There are places where you can't, but you should be able to go to your HR team and say, hey, we want to look at the data. I can almost guarantee that the response is going to be, well, you know, a little bit nervous of, well, what are you going to do with the data, right? But if you frame this around your inclusion initiative to understand how everyone is supported, you will breeze through it, right? And you know, especially if you partner with your senior leaders and how you're gathering the data. The other thing too, though, is on any number of these topics, you have to lay the groundwork, I believe, to push for a very thorough inclusion index internally, right? Something that you do biannually, where you're asking those questions David is alluding to about voluntarily disclosing some of these aspects where you can legally ask it, right? And there are outside companies who can help you set this up, and in fact, you probably will need to do it anyway so that you can maintain confidentiality. It's just easier to bring in a third party. And so they have the raw data, and you can guarantee to your staff that you don't track this down on a personal level. But that way you can understand the career trajectory around those who are disabled and satisfaction, and whether they're stuck on A, B, and C, and how they're faring based on your normative the average, right? But you really have to get committed from an organizational level to make that happen. And it's something that I think we pushed for years on our side, and we were able to do that. And I'm really happy that now we're able to start tracking and measuring against some of these wider topics beyond just the employee data at entry point when someone comes into our business.
Fantastic.
And I just one minor point. So from a UK perspective, I remember the nervousness around the gender pay gap reporting, and then it was legislated. And now people are not worried about it, and they see the benefit of it, and there's openness, and it's helped in so many ways. But if we go before that time, there was a lot of nervousness about we don't have enough women at the right level, we're not paying them the same, and there was just fear of shining a light on it. And I think it's very analogous to a lot of other areas.
Oh, good. Okay, thank you very much for that honest opinion. So, Simon, the next question.
Absolutely. So the question here is, how can organizations create opportunities for underrepresented groups to advance and thrive within the company, ensuring equity in their career progression?
Okay, who would like to take that one? Kevin, do you want to sort of have a view on that?
I'd like to defer that one on to Jeff, actually, if that's okay with you, Jeff.
Yeah, sure. And yeah, Amy, go ahead.
Yeah, I'll jump in for a minute. So, I mean, I can tell you one of the things that we do right now. We have 2 internal development programs that take a look at our top performing, like senior CRAs and getting them ready for that next step to eventually become a clinical leader, right? So instead of not looking at them and always going to the external marketplace, we created a kind of a mid-step in between, right? So we created an associate clinical leader role, and that allowed us to capture, people from all different backgrounds, right? It's a nomination-based process on set criteria, so it's consistent, right? So that means there's no subjectivity in it. It's if you meet the certain metrics, then you can be considered for this program. And I think that was, really smart, because we were always going to the external market. We were losing a lot of our senior CRAs who were kind of capped out at that level and wanted to do something, but we didn't really have that right position. So we created a position, right? So we created that opportunity. We removed bias because we made consistent metrics. So it's kind of, blind in that sense, right? As long as the people here meet the metrics, they can be considered. And since January of 2021, so 2.5 years since we launched that, globally, we've put about 185 people into that. So we retained them. We gave them a new career path, and we did it from a fair, balanced perspective. Like I said, we were able to just hit those set criteria metrics and not deviate. So that meant, people came from the same, quality pool and moved up. So that is one way that we did it. And I think that that's important. So if you're looking at, certain populations in your organization, and especially those in critical job families, right, that you want to retain, sometimes you actually have to push for a new opportunity, or in our case, we pushed for the creation of this new position and made that position protected for just internal people, right? So, that was one of the ways we did it. So that's one example. I'm sure, Jeff, you have some other things, but I did want to jump in on that one.
Yeah, thank you. That's an amazing example. I'll just share two pieces of learning, just in the interest of time. When you develop these programs, firstly, I I think it's really smart to assume your talent already exists and they're already talented, right? And so, you know, sometimes when we design these programs, we're thinking, oh, I'm going to take that individual who we see as unique and help create, you know, this career pathway for them. But really, in all honesty, a lot of it has to do with the ability for the organization, for your culture to recognize the talent, right? And has a way for that talent to excel, right? So it's not necessarily about training John to be even more John, right? It's about how do we see John for who John really is. And I think that has been key with the programs that we have designed. I'm also an advocate that everyone at some point should dial into their career always, right? We all have things to learn, but so much of this comes down to the responsibility of the business. It is also the learning curve of the business of how we allow that talent to support. And then secondly, we work really hard to make it easier for sponsorship to occur, because if you can't see that talent, then how do you help them advance, right? How do you get them in front of the right people at the right time? And so again, with our program specifically for talent that has been identified as high potential, we fold sponsorship directly into that. How do we get those individuals face time with the people who can really help shape their careers in the future?
Wow, that's fantastic. Okay, moving on very quickly. Simon, any more questions?
Yeah, we've probably got time for one more. So I think this is a great one to end on. In your opinion, what are some of the emerging trends or innovative practices that organizations should be aware of in the realm of diversity, equity, and inclusion?
Okay, so who would like to answer that one?
I'll make a start, but
Okay.
and somebody can come in with something way more thoughtful. But I think if we look at the business environment in general, and we work within health and science, you know, I'm amazed to see the innovations that our pharmaceutical and biotechnology and startup innovation organizations, what's in incubators, you know, the science is amazing, you know, from 3D printing to AI. You know, now the advent of what they call data 4.0 and machine learning, this I think is game changing for a lot of industries, maybe less so than us than it would be for finance or journalism. But we're going to have to evolve in a certain way. But actually, some of those assistive technologies that are almost deleterious effects of the main things actually have a huge application to allow us to be more inclusive, you know. So we talked earlier about remote learning remote access to work as a side effect of COVID, which helped certainly disability employment. It also helped, I think, parents who are able to kind of share responsibility. Although sadly we fell into stereotypical lines, certainly in the UK, where the burden of caring ended up being more on women for whatever reason. That's not a company thing, that's a culture thing. But I think that those trends that are hitting business are around, you know, a lot of the ESG end, you know, so, you know, the social agenda is clearly much more important, you know, the impact on the environment, technological innovation, all of these things give opportunities that if we're forward-facing business leaders and we have DE&I as part of our DNA, then we're going to take opportunity and capitalize upon it.
Fantastic. Okay, one more person.
Well, I would say, you know, the way that we as a business connect this back to patients is key. That is an emerging piece, right? Understanding that our patients are diverse and whether we are prepared and able to support that. Parexel is in fact working really hard to do this. And I would just say, you know, for CROs who are not looking at the patient population and experience of those who are, you know, based on race, ethnicity, or gender identity, or LGBT status, I think trials are going to become much more difficult and challenging, and it is where things are going. And you know, whether you know, the way in which we show up to support it and to help be a thought leader there, I think is important for a lot on this call. And I suspect if you know, those who are not successful or not paying attention to that could be left behind. That is certainly an emerging trend.
Wow,
Yeah,
that's fantastic. Okay, well, look, we're going to have to close there because we're already overrunning. I just want to say a really big thank you to the panel for coming along and talking to us today. It's been really insightful, and if anything, I think we should have put it in for 2 hours rather than sort of 3/4 of an hour, because there's so much to talk about here, and we might need to do another one and split it down a little bit. But certainly the things, your openness, your passion for what you're doing has really come across, and I'm delighted that you came and supported us today. So thank you very much. And thank you very much for the people that actually joined the webinar today. Thank you for coming along and spending your time. Simon, do you want to wrap up with the usual?
Yeah, absolutely. So thank you everyone for coming. If you do want a copy of the recording, you can email us at sales@PharmiWeb.com. In fact, if you have any questions that you didn't really get a chance to answer, please do send them our way and we'll make sure we get you an answer as soon as possible. We do have more webinars coming up. They'll be updated on the webinar schedule on our site very, very soon. But the next one will be how PharmiWeb can help you attract life science talent, and that will be taking place on the 26th of July. So you'll get invites for that shortly. So thank you again to everyone that's come along today, and we hope to see you next time.
Okay, thanks everybody.
Thank you.
Thank you. Bye-bye.